So which of the following statements are correct regarding the anti-glomerular basement membrane disease? So first is, it is a rare autoimmune disease which presents as rapidly progressive glomerulonephritis. So RPGN, rapidly progressive glomerulonephritis. Yes, this is correct. This is correct. Second, antibodies are formed against alpha 3 chain of type 4 collagen, GBM. This is again correct. Question number 3, the alpha 3 chain is expressed in the basement membrane of glomerulus. This is right. And the retina, no, this is wrong. It is in the lungs basement membrane. The disease may be associated with retinal hemorrhages when it is known as the Goodpasture syndrome. No. If the disease along with the glomerular basement membrane, so along with the problem in the kidney, it also associated with the hemorrhage in the lungs, then it is known as the Goodpasture syndrome. So again, this is wrong. So 3 and 4 are wrong. Only 1 and 2 are correct. So answer will be A, 1 and 2 only. Coming to anti-GBM disease, anti-glomerular basement membrane disease. So definition is, anti-GBM disease is a rare autoimmune disease in which antibodies are developed against the alpha 3 chain of the type 4 collagen in the GBM. So in the glomerular basement membrane, you saw there that there is type 4 collagen. So there is type 4 collagen. In the type 4 collagen, there will be various chains, but these antibodies are formed against the alpha 3 chain. Not all the chains, but alpha 3 chains. So you went into the glomerular basement membrane, you saw that there was type 4 collagen. In the type 4 collagen, there was alpha 3 chain against which antibodies are formed. So it's a rare autoimmune disease. So wherever in the body there will be type 4 collagen with alpha 3 chain, there will be problem, there will be pathology. So the pathogenesis is that the alpha 3 chain is largely restricted to the basement membranes of glomeruli and the lungs. Hence the disease may present with the involvement of one or both the organs. So only lungs may be involved, only glomeruli may be involved, or both may be involved. Now the clinical feature is, it may present with RPGN, rapidly progressive glomerulonephritis. Secondly, because we also see that the alpha 3 chain of type 4 collagen is also present in the basement membrane of lungs, so it may also present with the lung hemorrhage. Third, it may also present with both the organ involvement together, and then it will be known as the Goodpasture disease. Generally, Goodpasture disease is more common in the younger patients, and the older adults will only present with the disease which is limited to kidney only, so renal limited disease only. What is more important, that you have to diagnose this disease very early, because once the patient has presented you in such a condition that you have to go for dialysis, then in that condition it's very rarely seen that the renal function is recoverable. Even after using plasma exchange, glucocorticoid, immunosuppressant, you will not be able to recover the function of kidney. So that is why it is very important that early diagnosis is essential, as renal function is rarely recoverable in those requiring dialysis at the presentation. Now what is the management? So the patient should be treated with plasma exchange. This is an autoimmune disease. You have to do plasma exchange. You can use glucocorticoids. You can use immunosuppressants. What is the differential diagnosis? It is not always there that whenever a patient is presenting you with the renal pathology as well as lung hemorrhage, you are going to diagnose it with as Goodpasture syndrome. No, there is also one differential. So the combination of glomerulonephritis and pulmonary hemorrhage may also be associated in small vessel vasculitis. And which is small vessel vasculitis? Particularly granulomatosis with polyangiitis, which was previously known as the Wagner's granulomatosis. So you have to keep this differential also in mind, that this patient can also have Wagner's granulomatosis, which is now known as granulomatosis with polyangiitis. Second, lupus can also present with this condition.